If you are waking up several times at night to use the bathroom, or if your urine stream feels slow, weak, or difficult to start, that could be a sign your prostate is under stress. A lot of men ignore these early signs or try to fix them with over-the-counter supplements that often bring temporary or minimal relief. But what you drink every single day can quietly help or hurt your prostate in a much deeper way. Certain drinks go straight to the root of the problem by calming inflammation, improving blood flow to the prostate gland, and helping your body manage hormones like dihydrotestosterone that are often behind the enlargement. On the other hand, some of the most common beverages in men's daily routines are working against them without them even realizing it. These drinks can overstimulate the bladder muscles, irritate the prostate lining, and trigger more pressure, more urgency, and more late-night bathroom trips. That's something I've seen repeatedly in the men I've worked with in the last 15 years, especially those in their 50s and 60s who were trying everything except changing their drinks. So in this video, I'm walking you through 3 of the best drinks that actively support prostate health and reduce discomfort, along with 3 drinks you should completely avoid if you care about avoiding long-term complications. This is not guesswork. Everything I'm sharing comes from clinical experience and real research from respected institutions in prostate health. We're also going to cover one bonus daily practice that has helped hundreds of my own patients strengthen their bladder muscles, reduce urgency, and gain back control of their urination. Now we'll start with what I've found to be the most dependable and affordable daily drink for supporting your prostate. That's green tea. Green tea might seem simple, but what it does inside your body is far from basic. Each 8-ounce cup carries around 180 to 200 milligrams of a powerful compound called epigallocatechin gallate, often shortened to EGCG. This nutrient is not just another antioxidant. It has been shown in studies from the University of Maryland to actively reduce inflammation in prostate cells and even interrupt the action of a hormone called dihydrotestosterone. That hormone is one of the main drivers behind prostate enlargement, especially in men over 50. So when you consistently add green tea to your routine, you are not just soothing inflammation, you are helping to slow down the core process that makes your prostate grow larger over time. But that is not all. Green tea also contains L-theanine, about 6 to 8 milligrams per cup. This amino acid works to calm your nervous system without putting you to sleep. It can reduce the kind of physical tension and anxiety that often worsens urinary urgency and discomfort. On top of that, green tea provides a mild dose of caffeine, about 25 to 30 milligrams per cup, which is just enough to keep you alert without overstimulating your bladder or creating pressure in the lower abdomen. That balance makes it far more bladder-friendly than coffee or black tea, which tend to trigger urgency in men already dealing with prostate issues. Now let's take a closer look at how you can prepare it to get the full benefit. Use loose-leaf green tea instead of tea bags. A single teaspoon steeped in 175-degree Fahrenheit water, not boiling, for 2 to 3 minutes is ideal. Boiling water can destroy the delicate antioxidants that your prostate needs. Also, steeping too long makes the tea bitter and harder on your stomach. I always recommend my patients drink 2 cups a day, 1 in the morning and the second one before 4 in the afternoon. That timing helps reduce inflammation throughout the day while keeping your sleep patterns stable. When it comes to buying green tea, not all options on the shelf are equal. Go for organic varieties, and if you can, look specifically for Japanese sencha or ceremonial-grade matcha. These types are higher in EGCG and grown under strict purity standards. Stay away from bottled green teas you see in the refrigerated drink aisles. Most of them contain added sugar, citric acid, and preservatives that strip away almost all the actual benefits. Many also contain less than 10% real tea extract. That means they give you the illusion of drinking something healthy while offering none of the core nutrients. Also, look for packaging that is resealable and blocks light. EGCG breaks down when exposed to light or air, which can turn your tea into nothing more than flavored water after a few weeks. But even something as healthy as green tea comes with warnings. Drinking more than 5 cups a day can lead to irritability, trouble sleeping, and in rare cases, digestive upset. And don't drink it on an empty stomach. That is something I always tell my patients. The tannins in green tea can increase stomach acid and cause a mild nauseous feeling if taken without food. One simple way to avoid that is to drink your morning cup right after breakfast. In over 15 years of helping men manage their prostate conditions naturally, I have seen some of the biggest improvements in inflammation levels and urination control come from just one change, replacing the morning cup of coffee with green tea. And it is not just about urination. Many men report feeling more relaxed, less bloated, and even more energized in a balanced way. Have you tried green tea regularly? What changes have you noticed, if any, in how your bladder or prostate feels throughout the day? Let me know your thoughts in the comments, especially if you have switched from coffee and noticed any difference. That is your steady daily companion, but our next drink brings something bolder, with more targeted power to improve blood flow and even help defend against abnormal prostate cell growth. Let's break down pomegranate juice. Before we continue, I want to hear a bit more from you. Where are you tuning in from today, and what part of your health matters most to you right now? Whether it is staying active, avoiding medications, or keeping your independence as you age, your input helps shape this content. If you feel this information supports your health journey, type the number 1 in the comments, so I know to keep going in this direction. Now let's take a closer look at something many people enjoy for its flavor, but often overlook for its health power: pure pomegranate juice. In just one 8-ounce glass, you get a massive dose of polyphenols, roughly 800 to 1,000 milligrams. These are natural plant compounds that fight free radicals, lower oxidative stress, and help regulate cell behavior. Polyphenols are what give pomegranate juice its deep color, but they also play a big role in prostate health by protecting against cellular damage that can lead to abnormal growth. On top of that, one glass gives you 15 to 20% of your daily vitamin C and around 12% of your daily potassium. That might not sound like much, but when you add it to a balanced diet, it helps improve tissue healing, nerve signaling, and hydration at the cellular level. What really makes pomegranate juice stand out for men with prostate issues is how it works inside the body. A clinical trial done at the University of California, Los Angeles, showed that men who drank 8 ounces of pomegranate juice daily were able to slow the rise in their prostate-specific antigen levels over time. That number, known as PSA, is a marker doctors often use to monitor prostate inflammation or cancer risk. So when PSA stops rising as fast, it can mean the tissue is calming down. Pomegranate juice also boosts nitric oxide in the blood. Nitric oxide relaxes and widens blood vessels, improving circulation throughout the body, including to the prostate gland, where poor blood flow can worsen inflammation and increase discomfort. But let's get practical. The recommended amount for most men is 4 to 6 ounces per day. That is enough to deliver strong antioxidant effects without overwhelming your system with natural sugars. I always advise diluting it with water, about half and half. That keeps the glycemic load lower, especially for anyone concerned about blood sugar or insulin resistance. And make sure you drink it with a meal. Doing so slows the absorption of sugars and improves nutrient uptake. If you want to add some variety, there is a smoothie recipe I often suggest to patients. Blend half a cup of pomegranate juice with half a cup of unsweetened almond milk, 1 tablespoon of ground flaxseed, and half a frozen banana. This mix not only gives you the benefit of pomegranate, but also adds plant-based omega-3 fats, fiber, and magnesium. It is easy to make, great as a mid-morning snack, and helps stabilize energy without a crash. When shopping, Do not grab the first pretty bottle you see. Always read the label carefully. It must clearly say 100% pomegranate juice. Many brands mix in grape, apple, or blueberry juice, which waters down the benefits and raises sugar levels. Also, check the bottle material. Dark glass or BPA-free plastic is important because light and chemicals from packaging can degrade the antioxidants before you even open the bottle. There are some common mistakes that I see all the time. One is pairing pomegranate juice with processed snacks or fried foods. That kind of combo triggers inflammation and cancels out much of the benefit. Another is drinking too much. If you go beyond 12 ounces in one sitting, especially without food, it can spike your blood sugar and upset your stomach. Older adults are more likely to feel those effects because digestion slows with age and insulin response can weaken. Have you ever tried adding pomegranate juice to your daily routine? Or do you have a go-to drink that has helped your prostate or bladder health? Drop a comment below and share what works for you. Others in the community might benefit from your experience too. Now let's shift gears and cool things down with a refreshing habit that many overlook. Here is why waking up with warm lemon water can be surprisingly helpful for the prostate. This is not just a refreshing way to start your day, it is also a smart and gentle tool for prostate health. Just half a lemon squeezed into 1 cup of warm water gives you around 30 to 50 milligrams of vitamin C. That might sound like a small number, but it makes a big impact when taken daily. Vitamin C strengthens the immune system and supports connective tissue repair, which is important for men experiencing chronic inflammation in the lower pelvic region. It also promotes wound healing and helps the body absorb more iron, which supports better blood oxygen levels throughout the day. Beyond vitamin C, lemon water contains citric acid, which is known to support kidney function. Proper kidney function is key when dealing with prostate health because the kidneys and bladder work closely together. If kidneys are overloaded with uric acid or toxins, the urinary tract can become more irritated, which leads to urgency and discomfort. Citric acid also helps reduce the risk of kidney stone formation, which becomes more common as men age and dehydration increases. Warm lemon water can encourage mild diuresis, meaning it gently helps the body release extra water without pushing the bladder too hard. That makes it safer than coffee or other stimulants for men with an enlarged prostate. Lemon water also brings flavonoids into your system, natural plant compounds that have been studied for their anti-inflammatory effects. These compounds calm the tissue lining of the bladder and prostate and help ease oxidative stress that often leads to discomfort or swelling. I have personally seen men reduce their bloating, ease pelvic pressure, and even sleep better at night just by swapping their morning juice or coffee with a glass of lemon water. Have you tried doing that? If yes, how long did you keep it up? Let me know your experience with it. For best results, preparation matters. Use warm water, not hot, to avoid damaging the flavonoids. Squeeze juice from half an organic lemon into about 8 ounces of water. If you want to take the anti-inflammatory effect further, add a dash of ground turmeric along with a tiny pinch of black pepper. Turmeric supports the body's natural anti-swelling process, while the black pepper boosts its absorption. Timing also plays a role. Drink this about 15 to 30 minutes before breakfast to give your body time to process it gently and begin the day in balance. When buying lemons, go for ones that are firm and have thinner skin. These usually hold more juice compared to thicker ones. Bottled lemon juice, on the other hand, is not a good option. It often lacks the natural flavonoids found in fresh fruit and usually contains preservatives like sodium benzoate, which can disrupt gut balance and trigger inflammation in sensitive individuals. There are a few things to be careful about. If you have acid reflux, this might not be the right choice for you, as the citric acid can worsen the symptoms by irritating the lower esophagus. Another thing I always remind people about is the effect on teeth. The acid can weaken enamel if it sits too long on your teeth. So after drinking, rinse your mouth with plain water to protect your smile. One mistake I see all the time is adding sugar or honey to lemon water. While it may taste better, it also reduces its cleansing effect and turns it into more of a beverage than a health practice. Adding sweeteners causes a blood sugar response and encourages cravings, which can make it harder to maintain a clean morning routine. What do you usually drink first thing in the morning? Do you think starting your day with lemon water could help ease your symptoms or improve how you feel? Drop a comment below and share your thoughts. Your experience might help someone else going through the same thing. Hang in there, because the final two are game changers, and chances are no one has ever brought at least one of them to your attention. Now let's turn our attention to something a lot more aggressive. It often comes in flashy cans and promises quick energy. But what are these drinks really doing to your prostate and heart? Let's look into the risks of energy drinks. These are heavily marketed as performance boosters and mental enhancers, yet for prostate health, they often do far more harm than good. One 8-ounce can might contain anywhere between 80 to 300 milligrams of caffeine. To put that into perspective, 300 milligrams is like drinking 3 strong cups of coffee all at once, and many people do not stop at just one can. This overload of caffeine stimulates not only the brain and heart, but also the bladder, and when the bladder muscles are overdriven, the prostate capsule can become irritated and inflamed. Now, many energy drinks also contain guarana, which is another natural source of caffeine. That means the actual stimulant load can be much higher than what the label seems to suggest. These hidden caffeine sources create what researchers at the Cleveland Clinic have called caffeine stacking. And when this happens regularly, the prostate often responds with swelling and pressure. Have you checked the label on your energy drink recently? You might want to see how much caffeine you are actually consuming. Another big issue is dehydration. Caffeine acts as a diuretic, pulling water out of your tissues and forcing more frequent urination. But what most men do not realize is that this creates a cycle where the urine becomes more concentrated, which stresses the bladder wall and increases irritation along the urinary tract. If you already have an enlarged prostate, this leads to more urgency and discomfort, especially at night. Then there is the sugar. Most energy drinks contain between 27 to 40 grams of added sugar per can. That is about 6 to 10 teaspoons of sugar. Regular sugar intake like this spikes insulin and blood glucose, which can worsen inflammation and weight gain around the abdomen. Belly fat is not just a cosmetic issue. It raises estrogen levels and lowers testosterone, which can accelerate prostate growth and lead to hormonal imbalance. Let's not ignore the stress hormones. These drinks often lead to a quick burst of cortisol and adrenaline, and while that can feel energizing for a while, it creates a long-term problem. This hormonal surge activates inflammatory pathways in the body and can disrupt sleep patterns, both of which have been linked to worsening urinary symptoms in men. Do you ever feel more anxious, restless, or even bloated after drinking an energy drink? That could be your body giving you a warning sign. Common products like Red Bull, Bang, Monster, Celsius, and C4 fall into this category. And it is not just the drinks themselves. Many pre-workout supplements also contain yohimbine and beta-alanine. Yohimbine is a stimulant that affects blood flow and can irritate pelvic nerves. Beta-alanine can cause tingling sensations and tension around the pelvic area, which can worsen discomfort in men with prostatitis or chronic pelvic pain. I have had several patients come in thinking their gym habits were helping, when in fact their supplements were the root cause of their new symptoms. If you are looking for safer ways to stay alert, consider cold-brewed green tea with mint. It offers a lighter dose of caffeine along with natural antioxidants. Another simple option is sparkling water with a pinch of Himalayan salt and fresh lemon. That combination can help maintain hydration, support electrolyte balance, and even improve mental focus without stressing your bladder or prostate. One thing to always check on the label is the phrase proprietary blend. This often hides the actual dose of stimulants being used, and the Food and Drug Administration does not regulate these mixes very closely. Also be cautious of artificial sweeteners like sucralose and acesulfame potassium, and avoid drinks with synthetic dyes. These chemicals can worsen gut inflammation and indirectly affect prostate comfort. Do not make the mistake of drinking energy drinks before a workout. That can increase pressure on your pelvic floor and reduce circulation to your core muscles. Combining these drinks with protein shakes or alcohol is also risky. It creates bloating, slows digestion, and sends conflicting signals to your nervous system, which can affect bladder coordination. Have you ever felt more tense or uncomfortable after using energy drinks? Did you notice any change in your urinary habits after switching brands? Drop a comment below and tell me how your body responded. The more we understand these patterns, the better we can support each other's progress. Now we turn our focus to another popular drink that hides behind a healthy label. It is fizzy, calorie-free, and widely consumed. But is it silently harming your prostate? Let's examine what really happens when you drink diet sodas. A single 12-ounce can may not contain any calories, but what it does contain is a mix of chemical compounds that your body still has to process. Aspartame, one of the most common sweeteners in these drinks, is about 180 times sweeter than sugar. That extreme sweetness tricks the brain into expecting a sugar hit, which can confuse insulin responses and increase cravings, especially for carbohydrates. Now here is something many people do not realize. Sucralose, another artificial sweetener often found in diet sodas, has been shown in several studies, including one by the Weizmann Institute, to disrupt the balance of good bacteria in your gut. When gut bacteria are altered, the way your body handles estrogen, testosterone, and even cortisol can change. That shift in hormone processing can make a real difference for men dealing with enlarged prostates, as hormonal balance plays a direct role in how fast or how slow the prostate grows. Have you ever noticed a sense of urgency or increased bathroom trips after drinking diet soda? That is not just in your head. Phosphoric acid, another regular ingredient in these drinks, lowers the pH of urine and can irritate the lining of your bladder and urethra. For men who already have an enlarged prostate or existing inflammation, this acidic environment can make symptoms worse. It is one of the reasons why men with benign prostatic hyperplasia often say they feel more discomfort after consuming fizzy diet beverages. Let's break this down further. Artificial sweeteners like aspartame and sucralose are known to interfere with bladder muscle tone. That means they affect how well your bladder contracts and how completely it can empty. Over time, this can lead to a feeling of incomplete urination, frequent urges, and even disturbed sleep due to nighttime trips to the bathroom. These sweeteners are not neutral. They send signals to your body that result in physical changes in how the urinary system works. Top brands like Diet Coke, Pepsi Zero, Zevia, and even so-called zero-sugar energy waters all fall into this category. While they may look different, the ingredients list usually has the same red flags, and that phrase natural flavor on the can. That can still include synthetic chemicals, artificial acids, and hidden sweeteners that affect your system without you even knowing. Let's continue with some practical ways to quit. If you drink diet soda daily, start by cutting it with water so the sweetness becomes less intense. Then, try switching to naturally flavored options like sparkling water with berries, cucumber-infused water, or even herbal teas like hibiscus or peppermint. These not only keep you hydrated, but also contain antioxidants that may support your urinary system in a gentler way. Have you tried cutting back on diet sodas? What changes did you notice in your body when you did? Drop a comment below if you have gone through that experience. Your story might help someone else take the same step. Now we shift our focus to a drink that is widely accepted in social settings but can quietly inflame the prostate and throw your hormones off balance without you even noticing. Let's examine the real effects of alcohol on prostate health. A standard 12-ounce beer contains ethanol, and this compound plays a major role in how alcohol harms the body. Ethanol is a diuretic, which means it pushes the kidneys to release more water, leading to dehydration. When the body is dehydrated, the urine becomes more concentrated, and that places extra strain on the bladder and the surrounding pelvic muscles, including those near the prostate. Now here's something even more important. Ethanol also lowers zinc levels in the body, and zinc is one of the most critical minerals for male reproductive health. The prostate itself stores high levels of zinc for a reason. This mineral helps regulate inflammation, supports immune balance, and contributes to testosterone production. When alcohol reduces zinc, it weakens all three of these protective processes at the same time. Have you ever thought about how one drink could be shifting your hormone balance for the rest of the day? Let's take a closer look at histamines, which are naturally present in fermented alcohol like beer and red wine. Histamines are chemicals that trigger immune responses, and for men with enlarged prostates or chronic inflammation, this extra immune stimulation can make things worse. Histamines can raise body-wide inflammation and may even sensitize bladder nerves, which leads to more frequent urges and discomfort during urination. Red wine especially tends to be loaded with histamines, and I have seen many patients link their nighttime bathroom trips directly to just one glass. Now let's not overlook another lesser-known issue: the estrogen-like effects that alcohol can have, especially when consumed regularly. Studies from institutions like the National Institutes of Health show that alcohol raises aromatase activity in the liver. This enzyme converts testosterone into estrogen. When this process speeds up, it shifts hormone balance away from testosterone and toward estrogen, which is linked to increased fat storage, reduced muscle mass, and potentially faster prostate tissue growth. That subtle shift might not feel obvious at first, but over time it can compound, especially in men over 40. Let's go further into the drinks themselves. Beers, especially India Pale Ales, often contain high levels of phytoestrogens from hops. Phytoestrogens mimic estrogen in the body and can confuse hormone receptors. On top of that, beer contains purines, which break down into uric acid. High levels of uric acid can cause flare-ups of inflammation that are not just limited to joints, but may also affect pelvic tissues. If you thought red wine was safer, it might surprise you to learn that the histamine load it carries makes it one of the most irritating options for men already dealing with prostate issues. And what about mixing spirits with soda? That is a double hit. You are getting the dehydration and hormonal effects from the alcohol, plus the artificial acids and sweeteners from the mixer. Together, these can irritate the bladder lining and create even more pressure in the pelvic region. Many men think drinking only on weekends is a safe compromise, but even occasional binge drinking can cause temporary prostate-specific antigen spikes and worsen urinary symptoms for days afterward. Now, if you are wondering what to drink instead, you do not have to give up the social aspect. Non-alcoholic beers without preservatives can offer a similar experience without the same biological stress. Sparkling grape juice diluted with water is another way to join the toast without pushing your prostate into an inflammatory response. These swaps may sound small, but in my clinical work, they often lead to major improvements in just a few weeks. One patient told me that after skipping alcohol for 30 days, he stopped, waking up 3 times each night to use the bathroom. It completely changed how rested and clear he felt each morning. What about you? Have you ever noticed how your body reacts after a night of drinking? Do you feel more bloated or run down the next day? Let me know your thoughts or share your experience if you have tried cutting back. It is always helpful to hear real feedback. Now we move on to a different kind of tool for prostate support. Let's shift our focus from drinks to something physical that can quietly reshape bladder control and pelvic health. Let's take a closer look at how pelvic floor exercises can make a meaningful difference. These movements target the muscles that sit at the base of your pelvis. Strengthening these muscles directly improves how the bladder, prostate, and urethra work together. This area controls a lot more than most people think, and once the muscles start weakening, symptoms like urgency, frequency, and even leakage start to creep in without warning. The real value of pelvic floor training shows up in men over 50, especially those who have been through prostate enlargement or surgical procedures like transurethral resection of the prostate. I have seen many patients regain their confidence and sleep better just by building up these muscles consistently. Have you ever found yourself rushing to the bathroom too often or waking up multiple times at night? That could be a signal your pelvic floor is not as strong as it should be. Drop a comment below if this sounds familiar. You are not alone, and there is something you can do about it. Now let's look into how to do these exercises the right way. First, find a quiet moment where you can either sit or lie down. Then tighten the same muscles you use to stop the flow of urine. That is the key action. Hold that squeeze for about 5 seconds, then let go for another 5 seconds. Try repeating this 10 times in a row and aim for 3 sets a day. But keep in mind, the goal is to isolate the pelvic muscles, not the stomach, legs, or backside. If you feel those other muscles flexing, it means you are using the wrong group. That is a mistake I see a lot in the beginning. One more tip you should not miss. Do not practice these while urinating. It might seem like a good test, but stopping urine midstream too often can confuse bladder signals and lead to retention issues over time. I have coached many men on this, and what they all tell me months later is that they wish they had started doing these years earlier. The benefits build slowly, but they stay with you long term. And let me know your thoughts if you are already doing these or thinking of starting. Let's go over the key points so you can apply them easily. Drink 2 cups of fresh green tea daily, not bottled, to help lower dihydrotestosterone, which plays a role in prostate growth. Take 4 to 6 ounces of diluted pomegranate juice to support prostate-specific antigen stability. Start your morning with fresh lemon water to gently detox and support bladder function. Avoid energy drinks since they're high caffeine, and additives increase inflammation and stress the prostate. Cut out diet sodas, because artificial sweeteners and acids irritate the bladder and disrupt hormone balance. Keep alcohol intake very low, even on weekends, to prevent spikes in prostate symptoms. And do pelvic floor exercises daily to reduce urgency and leakage. Found this helpful? Subscribe for more and share your own prostate-safe drink tips below.